Hey everyone, and welcome. So, if you've ever heard the term gastric polyp, it can sound pretty intimidating, right? But what if I told you that they're not only super common, but that most of them are found completely by accident? In this explainer, we're going to demystify these little stomach growths, breaking down exactly what they are, how they're found, and what happens next. Let's dive in. Let's just start with this number, 90%. That is how many gastric polyps are found completely by chance. Just think about that for a second. A doctor is usually looking into something totally different, maybe some acid reflux or stomach pain, and they just happen to spot one. So what that really means is the discovery itself is almost always this unexpected surprise. So let's start right there, at that moment of discovery. You've just found out there's a polyp in your stomach, but what is that anyway? To put it simply, a gastric polyp is just a growth that forms on the inner lining of your stomach. And listen, here's the most important thing to remember right off the bat. The vast majority of these are benign. And benign just means they are not cancerous. You know, while most polyps are totally silent and don't cause any trouble at all, sometimes they're actually the culprit behind the very symptoms that led to the investigation in the first place. We're talking about things like bleeding, which can make you anemic and tired, or that nagging abdominal pain and reflux. And in super rare cases, if a polyp gets big enough, it could even cause an obstruction. Okay, so a polyp has been spotted, but just seeing it, that's really only step one. The next, and honestly, the most critical phase, is getting a much closer look to figure out exactly what kind of polyp we're dealing with. The whole process is actually very methodical. First, during an endoscopy, a tiny camera gives the doctor a perfect view of the polyp's size and what it looks like. Then, and this part is key, the doctor takes a biopsy. That means taking tiny tissue samples from the polyp and from the stomach lining around it. Those little samples then go off to a lab where a pathologist puts them under a microscope to make the final definitive diagnosis. And this is exactly why that biopsy is so crucial. It's pretty much non-negotiable. As the research makes really clear, you just can't be certain about what a polyp is just by looking at it. That tissue sample tells the real story. And not just about the polyp itself, but also about the health of the stomach lining all around it, which gives doctors really important clues. All right, so the lab results are in, and this is where things get really interesting. Because it turns out not all polyps are created equal, not by a long shot. There are a few common types, and each one tells a very different story about what's going on inside the stomach. Let's break down the big three you see here. First up, you've got fundic gland polyps. These are often linked to long-term use of certain acid-reducing medicines, and they carry the lowest risk. Then there are hyperplastic polyps. These usually signal some kind of inflammation, maybe from an infection like H. pylori. And finally, you have adenomas. Now, these are the ones doctors watch closely because they're considered precancerous, and they are always recommended for removal. You see, figuring out the polyp type is everything, because that one piece of information drives the entire game plan. It helps answer the big question: do we take it out, or do we just keep a close eye on it? And it really comes down to two main pathways. The first is observation, or what some call watchful waiting, which just means regular checkups with more endoscopies down the road. The other path is removal, which is called a polypectomy, where the polyp is taken out, a lot of times during that same procedure. So how do doctors make that call? Well, they're kind of like detectives, looking at a few key clues. First up, the type. Like we said, if it's an adenoma, it's coming out, no question. Size is also a big deal. Anything bigger than about 0.5 centimeter to 1 centimeter usually gets removed. If there are any abnormal cells, that's called dysplasia, that's a definite trigger for removal. And of course, if the polyp is causing problems like bleeding, well, it's gotta go. Okay, but here's something that is so important to understand, and it's easy to miss. Managing the polyp isn't just about the polyp. For instance, if a hyperplastic polyp is found, the most important thing to do is actually treat the H. pylori infection that's causing it. You get rid of the root cause, and a lot of times the polyps will actually shrink or go away on their own. All right, so let's bring it home and talk about the long game, long-term care. Whether a polyp is removed or just being watched, the journey doesn't end there. Surveillance is a huge part of making sure your stomach stays healthy for the long run. So take a look at this. It's a great example of what surveillance might look like after an adenoma is removed. At year 0, boom, the adenoma's gone. Then, about a year later, there's a follow-up scope to make sure everything healed up nicely and nothing's come back. After that, maybe another look in 3 to 5 years. It's all about being proactive. And I really want to stress this. This is not a one-size-fits-all plan. Not at all.
Your follow-up is going to be totally personalized. It's all going to depend on the type of polyp you had, your personal history, your family history, all of those risk factors. The goal is a tailored strategy that makes the most sense for you.
So look, finding out you have a gastric polyp, yeah, it can be a little unsettling, but understanding what it is, that changes everything. It turns that uncertainty into knowledge. The real takeaway here is that you are now empowered to have a really clear, informed conversation with your doctor. So the final question isn't for me, it's for you. What's the next question you're going to ask on your health journey?